This is how I do an endoscopic carpal tunnel release. This is a patient's left hand. Again, the landmarks that I identify the wrist crease here. I do make an incision in line with the wrist crease overlying the palmaris longus tendon. The palmaris longus tendon I know is going to be coming in this direction here. The FCR tendon will be radial. And then I know the median nerve is going to be underneath the antebrachial fascia, underneath the palmaris longus tendon in here. I also will mark out where I want to put the cannula when I insert it underneath the carpal canal. It will be in line with the ring finger here. And so I make a little dot here for where I want to put the cannula. Incisions here into the wrist crease. We'll look for any bleeders here. There's sometimes a bleeder right here at this, as we first enter in. Let's see the bleeder here. So we'll continue on. We're looking for the palmaris longus tendon here. Here's some fibers of the palmaris longus tendon here. So what we'll do here is we'll retract those fibers in the palmaris longus tendon, and we're going down to the antebrachial fascia. Again, the median nerve is going to be underneath this antebrachial fascia. I'm now going to make a small incision into the antebrachial fascia to identify the median nerve. I do make a transverse or horizontal incision, and there the median nerve lies here underneath the antebrachial fascia. The next part of the procedure involves taking a Freer elevator and placing it underneath the transverse carpal ligament, underneath the antebrachial fascia, and going into the underneath the transverse carpal ligament. And with my right hand, I'm now feeling the distal edge of the transverse carpal ligament, and again going in line with the ring finger where my dot has been placed. At this point, I'm trying to remove the tenous synovium from the inner surface of the transverse carpal ligament, and to make sure I've cleared off a nice space here. Once that is done, I will use the endoscopic carpal tunnel device here. I do use this device. It is a clear cannula. It allows for visualization with a scope. And then once you've used the scope to visualize and you're happy with your position, this has a holder for a blade that seamlessly goes into to be able to use the blade. It also has a mechanism here to where it can lock in and unlock. That's what we'll use to slide back and forth to visualize underneath the carpal canal, underneath the transverse carpal ligament in the carpal canal. Upon coming back to this housing area, that is when we can switch over to the blade, and it can be deployed for decompression of the transverse carpal ligament. It also then easily slides back in to a scope portion and comes back out. So this device, you want to put it unlock, put the lock, and this will fit onto a 30-degree reverse scope. And you depress the button here, and it gently glides on to the 30-degree scope and has a nice snug fit. I do make sure that my viewing is north in line with the light source coming into the scope. I'm going to place it underneath our leading edge or fascial band here, underneath the undersurface of the transverse carpal ligament. Again, I can visualize endoscopically while putting in to hopefully avoid some of the tenous synovium that's on the undersurface of the transverse carpal ligament. Again, I'm looking to go in line with the ring finger so I can actually palpate the fat pad, and that does appear to be the edge of the transverse carpal ligament here, in line with where I put my mark earlier. With this device, you can simply unlock here, pull back the device, and you're seeing the undersurface of the transverse carpal ligament. As we go back in, you can see the edge of the ligament here where the fat pad is. And you can easily see the transverse fibers of the transverse carpal ligament. The nice thing about the system that we use here is that it is a clear cannula, so you can pivot here in the undersurface of the transverse carpal ligament into the carpal canal, And a lot of times you can visualize the median nerve. This is looking radial, and the median nerve is protected in the carpal canal and is just to the right of my clear cannula here. You also can swing it back and look ulnarly, and sometimes you can visualize some flexor tendons moving back and forth underneath the clear cannula. So it does allow you to have a full radius and to be able to visualize throughout the carpal canal. Once I'm happy with my placement of the canal into the canal, I do take pictures to identify and mark it for visualization. I then will deploy the blade, and simply to do that, come over here, press the blade, it deploys, and out pops a endoscopic carpal tunnel knife. With good retraction from the assistant, you can now see the undersurface of the transverse carpal ligament. You can see the transverse carpal ligament being incised. There I've made a little small cut into it. You can see it starting to retract. And I'm aiming for that distal fat pad. I'm going from a proximal to distal direction. Once I get to this level, to make sure I've released it completely, I do insert the clear cannula in just slightly to allow it to get that final portion of the transverse carpal ligament. And there you can see that the transverse carpal ligament is completely incised and there's a good retraction. You could make a second pass if deemed necessary. I will come back and switch to the scope, which easily transitions to the scope. And you can see that the transverse carpal ligament has been completely incised and there's good retraction. Also, the nice feature about the clear cannula, I can go back and visualize radially, and that's where our median nerve is going to be located. You can actually visualize the median nerve if you kind of take a look over this side. And you can see that I have a nice radial leaflet from the transverse carpal ligament, and I do take a picture of that. I also can spin it back ulnarly and look to make sure that the leaflet here is also been incised. Take a picture of that ulnar leaflet. You can also, too, if you really wanted to, you can look down and look at the flexor tendons. But you can see you have a nice wide area here that has been released. Okay. I do a decompression of the antebrachial fascia onto the median nerve into the distal form. That's easily identified now because I have a leading edge here. There's the leading edge of the antebrachial fascia. So what I will do is take some littler scissors here, pass underneath, pass on top, and simply divide this antebrachial fascia. And again, I'm looking at the median nerve, and it's fully decompressed at this level. I'll take one last look as it enters into the carpal canal, and it is completely decompressed going into the canal. From there, the tourniquet will be taken down. Do place nylon suture, 4/0 nylon suture in a horizontal mattress fashion. Place a Band-Aid on the patient and recommend early flexion of the digits. The patient will follow up in my office in about a week's time to take the sutures out and to check and make sure they're doing well.